Well, hello and
Hello.
welcome. Hi, Stephanie, and to everyone else out there. Hello and welcome to our Shriver Hangout for September. This hangout is brought to you by the Sargent Shriver National Center on Poverty Law. My name is Amanda Moore, and I'm the Director of Online Content and Communities at the Shriver Center. And I'm very happy today to be talking with one of my colleagues, with Stephanie Becker. Stephanie is the Senior Policy Specialist at the Shriver Center, and she's also the manager of HelpHub, which is what we will be talking about today. Last year, Stephanie wrote an article, she co-authored that in the Clearinghouse Review. It was in our September-October issue last year, which focused on affirmative advocacy. And the article was about HelpHub, and it was called HelpHub, Technology to Build a Community for Affirmative Advocacy. And so she's going to elaborate on that a little bit today and show us around the site and explain to us what this site is and how it can be useful to advocates across the country. So Stephanie is joining us today from Chicago. So hello, Stephanie.
Hello, Amanda. Hello, everybody. Happy to be here. Thank you.
Thank you. Thanks for joining us. We're happy to have you here too. And we're happy to have all of you with us who are watching. And we want this to be a conversation. So please feel free to send us your questions, comments, anecdotes, whatever. There are two ways you can do that. And I'll explain those to you now before we jump in and talk to Stephanie. So the first is, if you are watching this through the Google Plus Hangout, you can hover your mouse over the left side of your screen and you'll see a toolbar pop up. And one of those icons is blue and it says Q&A. If you click that, you'll have a chat box open down the right side of your screen, and you can submit questions to us that way. If you want to go ahead and try it out, that would be great. You can send us your name and where you're watching just to test it out and let us know you're out there. The other thing you can do, I know that some of you are watching through YouTube, watching the live stream through the Shriver Center's YouTube channel. If you're doing that, we would still love to hear from you, and you can contact us through Twitter. You can use this hashtag here, Shriver Hangout, and tweet to us your questions for Stephanie about HelpHub, and we will get those answered. So, Stephanie, I want to just sort of jump right in with the basics here. I've been talking about HelpHub, but haven't really explained to everyone what it is yet, because I figure you can do that better than I can. So, would you tell us what HelpHub is?
Absolutely. Yes, I'd be happy to. So we like to think of HelpHub as a combination of a Facebook and an advice column, but it's directed solely at Affordable Care Act enrollment specialists and care coordinators in Illinois. So what, at its essence, it's a website, but it's where policy specialists, such as people at the Shriver Center and other places, can answer questions quickly that are asked by enrollment specialists in the state. And then also HelpHub members, which include people who are navigators or people who are care coordinators at health plans, can help each other troubleshoot problems and also share best practices. And so this is all happening in real time. And so we can answer questions really quickly for folks.
Well, that's great. What?
Yeah.
Go ahead. Did you want to elaborate?
No, I would say we've been doing this now for 3 years. We launched in October 2013 when the Affordable Care Act coverage provisions really started. So we've been pretty busy ever since. And then the activity kind of ramps up around open enrollment times, which is coming up in November.
Right. Well, I think one of the best ways for everyone to understand what you're talking about is if we could take a look at it. So would you want to give us a little tour of the site? We'll be able to see that on our screens.
Sure, I'd love to. Just a moment. Okay, so here I'm going to just show you how someone were to sign in. And so this is basically the homepage of the site. And it's like your news feed, and it's a brief rundown of announcements where we post, for example, policy guidance from CMS or from the state, and CMS is the Federal Centers for Medicaid and Medicare Services, for those of you who aren't familiar with that. So we do a lot of putting out of information that's important for enrollment assisters. Also on this page, we have tags where people can click on things that are important to them and get connected to whether it's questions and answers about that, or documents, or stories. It's a one way to navigate the site. Also on the homepage, you can get to kind of the bread and butter of the site, which are these questions and answers. And I'll go into one in more detail later, but this is really where, and you can see, already today there's been a bunch of questions and answers, postings of various events and documents, and we spend a lot of time kind of on this question and answer page.
So this is kind of what you were talking about, being sort of like Facebook in a way. It's kind of a real-time feed of people who are also on this community.
Yes, exactly, right. So here we have members of the community. This is someone, an enrollment assistant in Chicago, in addition to Catherine Nelson, who's one of our experts in Medicaid. And so it's just basically conversations. And here I'll just click on one now so you can see. So here someone asked, maybe they're a new person who's never worked on a Medicaid case before, and they're just wondering how to report a change in income for all kids, which is our Medicaid for children in Illinois. And so I was able to assign this. I saw this come in this morning, so I clicked assign and I assigned it to an expert, and I chose Catherine because she's very skilled in this, and she answered right away of how someone were to report a change in income. And so sometimes the conversations happen fluidly, like on Facebook, someone might see it themselves and post it. But the great feature of HelpHub is that we moderate it, and so someone isn't just hanging out there with a question unanswered, for example. And then if someone were to want to weigh in again and ask another question, they could just say, they could share their thoughts and click post, and then they would post, kind of like on Facebook again, sort of a chain of a conversation. Also, I'll quickly go, there's a people tag, which is a really great way to find people in your area who may be working on issues similar to you, but you just don't know them yet. So, for example, you can search, if I wanted to know who else was working on these issues in Rockford, Illinois, I could search for Rockford and it would come up. And so that's really helpful if you're planning events, enrollment events coming up. You can, see who else is doing that and connect with them via email very easily. We also have our list of experts, which include people from the Shriver Center, include some tax services folks, which has been really helpful for under the Affordable Care Act. There's lots of tax questions. We actually also have some government liaisons here. So this is our HHS regional coordinator, Brenda, who may not be as active on HelpHub, but I can tag her or show her that there's a problem that someone's having, for example, on the training, and I can connect her. She may not answer on the site, she might answer to me, but she can see really quickly that this is a problem that's happening and then address it. So that's the people tag. Other events and webinars is pretty self-explanatory. We post a lot about webinars coming up, best practices webinars from around the country and in the state, some enrollment events. Documents, this has been extremely helpful for folks who want to share, let's say, a Spanish language document on public charge or an immigration issue. This is where a lot of enrollment specialists around the state can quickly share best practices so they don't have to reinvent the wheel. So we do a lot of sharing. The question and the answer we already saw, which is just the kind of constant stream you can see of questions happening, and these are the conversation threads that go on all the time of a variety of issues. And then the last thing I'll mention is the stories. And this is where we encourage people to post success stories if they have them, or challenges with enrolling people. And a lot of times we use this as a story bank if we have journalists come to us and say, we want to profile someone who got on Medicaid or got on the Affordable Care, the marketplace for the tax credit. And so we don't allow journalists into the site, but we can at least link someone to a journalist if they're willing to talk to someone. So that's the story function. I can stop there if you think that's helpful. And
sure. Could you show me the home tab again? I was trying to remember what appears there on your first screen?
Yes. So the home tag, now let's say that if I were just to logged in, the home tag would show some of the announcements up at top first, and then this list of questions. So if someone were to sign in right away, that's what they would see right away. But it's also where you can go, and if most people either ask questions or really peruse this question and answer thread. We did a survey, and that's the way most people use the site. So we can also quickly, get to ask for advice here, and it's, we give some guidance on how to ask a question and how to use tags, and also a note about privacy. I should mention, we always tell people not to put client information directly on the site. And if they have a specific case, they contact us outside of the site with client-specific names, or even Medicaid, Medicaid case numbers, things like that.
That makes sense. We have a question that's coming from Lucas. Lucas, I see your question, and it's a really good one, and I'm going to ask it. I'm going to hold it for just a minute so we can do a little more of the preliminary sort of introduction to the site, and then we'll get to your question. And that's a reminder to all of you, we do welcome your questions. So you can submit those through the Q&A app within the Google Hangout, or you can tweet with the hashtag Shriver Hangout, and we'll see a question that way as well. So this, it looks like a fantastic site. It looks very clean and easy to navigate. One of the things that your article focused on, and that really it's kind of one of my main interests in showing the site to our Hangout viewers, is the framework that you put it in of being part of a toolbox for affirmative advocacy. And by that, I mean, we think of sometimes as in our work as legal services attorneys, a client comes in with a problem, we handle the problem. A client comes in with a problem, we handle the problem. With affirmative advocacy, we're talking more about a broad-based solution to something that will affect, a whole group of our client population without having to deal with a one-on-one. So how have you found that technology like this, using an online community like HelpHub, can support an affirmative advocacy strategy?
Yeah, it's a really great way to kind of address systemic issues rather than sort of client by client issues. And I can give you an example of one, but it allows us to quickly look across the state at people doing similar things. So, right, the Affordable Care Act was a perfect experiment because this was all new for everybody. And so we launched on October 1st when the marketplace healthcare.gov launched, and kind of waited to see what would happen. And we started to get, and it was implemented, obviously, around the country, the Affordable Care Act. But what happened is that we started to get problems come in on HelpHub about a couple of things, about healthcare.gov, and we know that was reported all across the country, but specifically about some problems legal permanent residents were having getting tax credits. And we knew the policy said that they were eligible for tax credits, low-income legal permanent residents, but healthcare.gov was not allowing that to happen. And so we had people write in sort of documenting this issue, documenting what happened, that the call center wasn't giving them tax credits, that the actual computer system wasn't. So we alerted HHS, so we have good relationships with our partners, federal partners, and it's funny, at first they thought it was just an Illinois problem, and they said to us, oh, that must be problem you're having. Well, soon, maybe a couple days later, they heard from people in Montana, from Kentucky, from all over, that they were having that problem, and they realized it was a systemic problem. And so that's what I mean, is that it's, and actually, we're still trying to work through some of those issues with immigrants and healthcare.gov, but now we know what the problems are, and we're able to work with them in retraining their call center staff, in helping with some of the computer issues. So I think being able to document the actual problems that are happening, not just to one person, but to 20 people, was extremely helpful.
That makes a lot of sense.
Yeah, one example of affirmative advocacy. And then other sites, when we did some research on it, the city of San Jose, we did a similar thing when they were doing city planning, and they were able to hear from all different sectors of the population. And that's why this is good too, is maybe people who wouldn't normally talk to one another, librarians who are working on this can talk to case managers, in a different part of the state, and they're having similar issues. So it provides a good way to have conversations.
Right. So it's not limited to something like the Affordable Care Act implementation. You could use the same model in other policy contexts. Which does lead me to this question that Lucas has submitted, and it was something that you and I were talking about before we started the broadcast, about the loop, that there's a national site that's a parallel to HelpHub. And so his question is, would you encourage other states who participate in the loop to explore a state-specific website? And how much did it help to have a state-specific site?
It's a great question, and all of us who are on HelpHub also use In the Loop a lot, and it's wonderful to have it's wonderful to have both, really, because on the national level, and I use In the Loop a lot of times when I get questions on HelpHub that I can't answer because I'm not an enrollment assister per se. I'm more of a policy person, and there's lots of enrollment assisters from across the country who are using the federal marketplace. And so I use In the Loop in that way and get very quick, really good responses from fellow enrollment assisters across the country. The way it's helpful for a state and for Illinois is that we also have a lot of Medicaid questions, which if I've learned, Medicaid is very specific to the state. And to answer a question about Medicaid, you have to really understand all the policies and all the eligibility rules. And so it's probably a little harder for someone on In the Loop to answer that question quickly. We're able to troubleshoot those pretty quickly, and we have good relationships with people at the state level. And so even if we don't have an answer, we can triage that pretty well. And so that's where kind of a state-based kind of In the Loop or a HelpHub works well.
Well, thank you, Lucas, for that great question. I appreciate that, and want to remind all of you, we welcome your questions. Just the same, you can submit those through the Q&A app on Google Plus, or through Twitter at use the hashtag #StriveOrHangout. So if someone in a state, if an advocate in another state wanted to start something, maybe they want to start an Affordable Care Act implementation site similar to HelpHub, or maybe they want to start something for a different big push for some sort of policy implementation, how would they go about doing that? How do you start something like this?
Yes, so I think I was thinking of a couple things that you need. I mean, you need a built-in audience. We were a little worried, we built the site, will they come? It's great to have this wonderful, kind of beautiful platform, but if no one's filling it with content, it's meaningless. So you have to make sure that there's a groundswell of interest. And so we do, in addition to this technical assistance center, we do trainings across the state on the Affordable Care Act. So we already knew that there was sort of an interest in and kind of boots on the ground who were doing this that would use this site. So that's one. I think too, in terms of people power, you need to have a person, doesn't have to be a full-time person, but a person dedicated to moderating it and making sure that conversations just don't die. Because I think that can be deflating for people to put something out there and then not get an answer. So that's what I spend a lot of time doing. And I don't do it alone. I use other experts to help me. So that's the other thing I would say, is that if there are issue areas that you think, start with a couple experts that but then I've been able to pull in experts, and people have been very gracious with their time, and we're not paying them to do this, but to answer questions, for example, on tax issues or on legal assistance specifically issues, or of justice involved. So just having kind of experts at your fingertips is really helpful. And then lastly, but importantly, is cost, right? So we were able to start this up with some startup costs from grant money from the Robert Wood Johnson Foundation, and also from a federal CHIPRA grant. It was helpful that when at the start of the Affordable Care Act, there was a lot of interest in making sure that this went smoothly. So that's where this grant money came from. So I could tell you it wasn't much at first, it was $20,000 to kind of start it up. But then you have to have, there's costs over time for hosting and enhancements over time. So you do have to, when we write grants, we put in money specifically for HelpHub, just knowing that we want to sustain it and keep it fresh.
Mm-hmm. That was one of my questions. I was going to ask how you do the maintenance for the site. Do you have IT people on sort of on the, I want to say retainer, but I don't know if that's the right term, but someone at the ready to address any technical problems that come up?
Yes, that's so important. We do, and we worked with a company, and we work with a company called Webattacks, and they are here in Chicago, and they were actually experts in this type of platform. They had done it before for a different set of professionals, and they have a couple different sites completely outside of the health policy sphere that they still run. But so we are able to, troubleshoot if we have problems. I just email them, and they help. Not only do they help sort of fix the problems, but they help us think about interaction between members. So that's their specialty, is how to make it so that the members really are engaged and kind of own the site. So for example, they encouraged us to not have set tags, but have member-driven tags, so that when people put questions, they kind of come up with their own tags. We have our own set that we, hope that people will use, but things like that, where they really are, experts in this type of technology where, we're not. So that's another. And you could, if someone has a computer person or a computer team on site, that you could do that. You could have them be your tech help too.
Mm-hmm. So how did you, you kind of explained the mechanics of how HelpHub started, but I'm curious about the idea of saying, we've got this big thing coming up, and it would be great if we had a way for everyone to talk to each other. Mm-hmm. How did that idea germinate? Where did it start?
Well, so that's a great question, and it started back before the Affordable Care Act was passed. A group of funders in Chicago, sort of progressive health funders and policy groups, were getting together and sort of thinking through, we want to make sure, especially in the president's home state, that the Affordable Care Act rolled out in a good and coordinated way. And so as a result of that, we started a different website called Illinois Health Matters, which was really there just to provide nonpartisan, objective information about the Affordable Care Act. And that started in 2010, I even think, or 2011. And then at that point, when we realized that soon people were going to be enrolling, we just had the idea of an offshoot of that website being another kind of microsite, if you will, where people could really talk to one another. So as opposed to just Illinois Health Matters was just about pushing out information about the Affordable Care Act, this was more going to be a conversation about the Affordable Care Act. So it kind of happened organically, and we were comfortable running a website, and so it became comfortable running this microsite. So that's.
And how many people did you say are members of the site now?
So right now there are a little over 1,200 people on the site. And as you can imagine, it ebbs and flows in terms of activity, in terms of open enrollment. I looked at the analytics, and when we get between, on the weekend we won't have much, but on a regular day we might have 50 people on the site. And certainly during open enrollment, it could be hundreds of people on the site, because sometimes we're very nimble. We're able to post things maybe even quicker than the state can in some cases. So. Right.
Well, that's great. So what do you anticipate happening? You said, so open enrollment is coming up, and you have to kind of gear up for that. What do you anticipate? Just more questions about specific client questions, or systemic questions of, the actual enrollment system?
Yeah, so I'm hopeful that it's gonna, and I think it will run much more smoothly this time than it has. Every year it's gotten better. We always have new people on the site, new navigators, new certified application counselors who's never been through an open enrollment. So we will always have new questions just about basic eligibility, between a lot of people. It's so complex, right? About how does Marketplace and Medicare fit together? How about Medicaid? If someone's eligible for Medicaid, can they choose Marketplace instead? These are just kind of small, kind of policy wonkish questions, but we encourage, no questions too small. We'd rather you ask on the site rather than kind of, sit with the client and not know. So I anticipate a lot of maybe basic eligibility questions. We're also, in Illinois, and maybe other states are doing this, we're moving a lot to Medicaid managed care. And this is new for a lot of Medicaid enrollees. So we're starting to get a lot more questions about, how do I sign up for my Medicaid managed care plan? What does it mean even moving now to more health literacy. You know, what does it mean to make a preventative care appointment? Things like that. So I think those will continue to happen. We always will see problems, and that's, you know, we normally see problems about when people aren't able to see their caseworker, or they, a lot of times we have to elevate cases if they haven't heard for over 45 days, let's say on a Medicaid application. So those are constants. And then I would guess that we'll just see some more in open enrollment, just about kind of the practical eligibility about marketplace and tax credits.
Well, we are, surprisingly, it always shocks me how fast this goes. We're nearing the end of our time. So I want to remind our viewers, if you have a question, or if you want to share your experience with using a type of online community like this to support your advocacy or policy implementation, let us know. We'd love to hear from you. I do have another question for you. I guess it's a two-part question. How did you get the word out to those 1,200 people and convince them that this was where they needed to be to support their work? And then do you have a sort of membership clearance process or something where do they ask to be added to the site, and then you have to sort of check what their role is to approve or not?
Yeah, yeah. So to your first question, we, because the Shriver Center is part of the official navigator training team in Illinois, when people went initially to get their certification with the state, there was, they went to a place called Public Health Learning, which was a different website. But on that, they were told about HelpHub and were encouraged to apply. They didn't have to, but that's where we got a lot of people. And then, and we still get a lot of people. And then when we go out to meetings and we do presentations, we also encourage, for example, a colleague of ours just did a presentation to the nurses at Chicago Public Schools. And so we'll ask them if they want to be on. And there is a clearance process that happens where they just have to tell us about their experience and why they want to be on. And then, you know, we'll add them in. Right.
Makes a lot of sense. All right. Well, Stephanie, I want to thank you so much for introducing this to our viewers and telling us more about it.
Sure, my pleasure.
I learned a lot. I've really enjoyed it. And I want to thank everyone for tuning in today. And I'll remind you that you will receive an email afterwards, everyone who registered for the Hangout will. And that Hangout will include a link where you can watch a recording of the Hangout. So even for people who weren't here today, they'll still be able to watch and get the tour and hear from Stephanie. We will also include a link to Stephanie's Clearinghouse Review article from last year, which is still very relevant. It was called HelpHub, Technology to Build a Community for Affirmative Advocacy. So you'll be able to check that out, and I encourage you to do so. I also want to invite you to tune in again next month for next month's Shriver Hangout. That will be on Wednesday, October 21st, the same time as today's Hangout. It will be at 1 o'clock Eastern at noon Central. It will last for half an hour. Have a sandwich, join in with us. Next month, I will be talking with Richard Marcantonio and Sam Tepperman-Gelfont from Public Advocates in the Bay Area. And we will be talking about their community lawyering work and ways they found to make public participation processes much more powerful and to have a much longer term effect on community building. So it should be really interesting. They've written an article called Seizing the Power of Public Participation. That will be our October Clearinghouse article. It should be published either at the end of next week or the beginning of the following week. You can find that here on the site at povertylaw.org/clearinghouse. So there will also be a link for you to register for that Hangout for next month that comes in that email with you. So again, thank you so much for your time today, Stephanie.
Thank you. It was great talking to you.
Well, thanks. And thanks to everyone who joined in, and I hope to see you again next month.